Hey, I'd like to welcome you to another episode of Mission Matters. My name is Adam Torres, and if you'd like to apply to be a guest in the show, just head on over to missionmatters.com and click on Be Our Guest to Apply. All right, so today I have Krista Smolda on the line, and she's Chief Brand and Product Officer over at Care Talk Health. Krista, welcome to the show.
Thank you so much for having me, Adam.
All right, Krista, so we got a lot to talk about today. So we're going to talk about outsourcing care management for Medicare patients. We're going to get into what you're doing over at Care Talk Health. But just to get us kicked off, we'll start this episode with what we like to call our Mission Matters Minute. So Krista, at Mission Matters, our aim and our goal is to amplify stories for entrepreneurs, executives, and experts. That's our mission. Krista, what mission matters to you?
Other than being a wonderful mother and producing children that are contributing members of society,
Yes.
a mission that matters to me is to really assure that what I'm doing, what we are doing over at Care Talk Health and building right now will be something that in the next 5 to 10 years becomes a common practice in healthcare. So we're not in it just, to ride on a fad or anything like that. When ideas become realities and become, into fruition, it's very exciting. That's happening now. And so what we're doing is real. It solves a problem in the healthcare system, which we'll talk about later. So for me, it's making sure that all the time and energy I'm putting in right now in creating solutions that solve problems are not just something that sticks around temporarily, that they actually become the norm and ultimately help the elderly population get the care and the attention that they deserve. So that is the mission that really matters to me.
Amazing. Love bringing mission-based individuals on the line to share why they do what they do, how they're doing it, and really what we can all learn from that so that we learn and grow together. So great having you on. Just to kind of start at the beginning here, like when did you first get involved with healthcare? Like how did all that happen?
Oh, it was the grace of God that got me into healthcare. I spent
Yes.
15 years in the telecommunications industry. I was actually working at Comcast for all of that time. I was managing their outsourced call centers, then spent another 5 years doing the same thing for a large company. And, I just got burnt out. I wanted to do something that would be more creative, that would allow me to lead a little more, a large organization. Comcast, you're just kind of small there. And so I felt like it was time to leave. And I literally quit my job one day.
Wow.
And I leaned on my network of people that I had, built through the years, a lot of very intelligent entrepreneurs. There was a man named Donnie Gross who I worked with at a previous life. And he's the kind of person that if he calls, you take the call.
Yeah.
He called me 4 years ago and he said, "Hey, I have a business idea. I've always respected you. I think you're very intelligent. Meet me in Delaware, and I want to present an opportunity for a business I want to start." And so I got in my car and I drove, and we had a great conversation. And he introduced me into healthcare to actually start the business that I'm in right now. And I'm grateful to have been given the opportunity to learn a new business, but more importantly, to make a difference. Which goes back to the original mission.
Now, I know you've been in this business a bit, but if I can stay in those early days just a little bit longer, I'm curious as to, other than obviously the business side of the opportunity, but a lot of times when an entrepreneur sees something, when you're creating a business or something else, there's a problem that you're looking to solve, ideally, right? If you're looking at, or a niche or a community you're looking to help. As you were kind of tooling up and learning your knowledge on the healthcare side of things and maybe some of the opportunity areas, did anything surprise you?
Yes. What surprised me was, well, first of all, I did more reading in the last 4 years than I did in the 16 years of schooling. I was just.
It's heavy learning a new profession. I love that you did that, by the way.
Thank you. And I'm like, is this really happening? Right? Like, are these people really going to be in trouble? In 2030, it's going to be 90 million people that are over 65. And right now there's 66 million. And by the way, at the same time, what's happening is there's a physician shortage, right? I think at the end of this year will be 64,000 that are just kind of leaving. That'll be 86,000 short in 2036.
Yeah.
And so you go, okay, now I understand what the U.S. healthcare crisis really is.
Not just like a headline that's like a quick blurb or something on Instagram. It's real.
Yes. People are getting sicker, so that's going up. and then the physicians and nurses available is going down. So this is where this problem occurs.
Mm,
I also learned a lot about Medicare and the all of the services that are available to patients, but
mhm,
that unfortunately they can't take advantage of because the doctors are too busy to
mhm,
give the extra services to
mhm.
patients.
Yeah.
And so yeah, that was a problem that I thought our company, which is, a telehealth company,
Mhm.
we can help solve that problem. We
Yeah.
can definitely make a dent in the problem.
Yeah, and speaking of Medicare, I know that you can help more than Medicare patients with in your company, but today I know we're going to focus a bit on that side of the business. But I do like to preface that in the conversation that I know that
Mhm.
you're helping a lot of different areas, but we'll probably get a little bit further into Medicare patients as well. But before we do that, maybe let's start with a broader discussion of just the care in general. Maybe start with like value-based care and just even what that
Yeah.
means, defining that, because it's a term that's thrown around a lot, but maybe
Mhm.
not as much understanding as we'd like.
Yeah, I definitely didn't understand what it was on day
Mhm,
one. I can tell you that. But basically, what it is, it's a healthcare delivery model, and it
mhm.
ties the amount. When I say the amount, I mean the amount of money that the providers are making for their services, but it directly correlates it to the value of the delivery of the services, right? So
Mm,
it's designed to focus on quality of care, provider performance, patient experience. It's taking value and it's putting more on that than there is on volume. Okay.
mhm,
So there are actually quality measures that are out there now, terms like HEDIS scores and CMS star ratings, where providers, ACOs,
mhm.
organizations are scored on this value that they're bringing to the patients. It's no longer about
Yeah.
how many can you pump through the system. Are they repeatedly going to the hospital? Are they getting better? Are they getting the time and the attention that they need?
Mhm.
Think of this as sort of like a report card, right? So if you have a bad grade on your report card, you're not
Yeah.
going to get paid as much money when you submit that claim, right? And
Mhm.
so on the flip side, if you're doing good and you have a good score, you're going to get financially rewarded. So providers are their financial dependency is
Mm.
really they've got to get down this value-based care system. If they don't, 2030 is the deadline, they're going out of business. So
Mm.
that's a problem.
Yeah, that is a problem. And so what happens next with this? Like if as people are not like how is the industry tooling up? Like how are people like adjusting for this?
So they're adjusting in a few ways. One of the ways I think they should adjust. I talked about the problem where
Mhm.
there's too many sick people and not enough nurses and doctors to take care of them.
Yeah.
They would use a function like virtual telehealth,
Mhm.
take care of some of those problems for them, some of those visits. Not
Mhm.
everything needs to be in person, right? You can get a better grasp on how your patients are doing by outsourcing some of those functions like doctor
Yeah.
visits, nurse visits, right? Annual wellness visits, getting those quality scores up and outsourcing
Mhm.
that function to companies like actually Carrot Talk.
How has the concept of outsourcer been dealt with in the past versus now? Because I feel like now there's obviously a bigger need, and maybe always was a need, right? But now it's front and center, like it has to be done for certain areas if they're going to catch up. So like that's for that problem that you're mentioning. Like how has it been done in the past versus kind of like where it's being done now? Because I'm trying to understand. Like it seems to me like, and I've never run a clinic, right? So it seems to me like it would be something that somebody would be like really warmly embracing, like yeah, like a outsource, like let's get maybe more efficient, let's do this, let's do that, let's become more even more profitable, right? How does the industry look at it though, as a clinician or as somebody owning a clinic? Like how does the industry look at that?
So I think the functions that are being outsourced now are
Hmm.
more administrative functions. For
Yeah.
example, hey, we've got a bunch of people that we have to get in. Let's have some other company make a bunch of phone calls and get these people to show up for their appointments, right? To book the
Hmm.
appointment.
And would you say that's the, just for context, would you say that's the bottom of the not bottom, but like one of the most basic services? That might be a better way to word it.
Yeah, yeah, it is.
Okay, go
And
ahead. I'm just trying to understand it. Go ahead, please.
yeah, I don't think it's about, how has it been done then versus now. I think it's for doctors anyway, and for healthcare
Hmm.
organizations that have patients, there's a trust factor where they are hesitant to outsource
Yeah,
a
I
doctor
understand.
or a nurse visit. And so that is where, really having an organization that and I'm going to Care Talk Health, we come from large organizations. We also
Mhm,
have people that really understand healthcare, and we understand the importance of the doctor and the office and
mhm,
the practice having to, after the interaction occurs with our doctor or our nurse, to have that information given back to them so that the continuity of
mhm,
care is kept throughout the process.
mhm. What are some of the so help become a shopper, if you will, with me? What are some of the things that if there was a checklist of things, because you did mention one or two just now, but if there was a checklist and a doctor or clinician or somebody's watching this and they're saying, we should really consider this. What are you being in the space? What are some maybe things that they should be looking for in whomever is going to be their outsourcer?
Yeah. So there's three things that come to mind. Number one, if we're speaking of this, value-based
Mhm.
care,
Yep.
quality scores, right? Hey, let's get the good. There's a lot of open gaps in care, what we call gaps in care,
Hmm.
is all revolving around preventative things like, did they get their annual wellness visit? Did they get their colonoscopy, booked? Are they getting their A1Cs measured? Are they monitoring taking their medicine properly?
Yeah.
So a gap in care is something that if it's not checked off and it's not done,
Hmm.
the score becomes lower. And so
Mm.
gaps in care, not all of them, but a lot of gaps in care can be outsourced to someone virtually to just kind of check the box and get it done.
Mhm.
That's one. I think the other service that doctors and healthcare organizations should be taking advantage of is chronic care management,
Mm.
remote patient monitoring, because what chronic care management came out in 2014, believe it or not.
Mhm.
And
Mhm.
why did Medicare think chronic care management was a service that they should cover? Because of what I previously said before.
Mhm.
Patients with chronic disease, it's over 75% of the Medicare population has two or more chronic conditions. So it's a lot
Yeah.
of people. It's a fact that they require more time, more
Mhm.
attention,
Mhm.
more talking to in between doctor visits. But again, the doctors don't have time. So the chronic care management program basically says, hey, doctors, we're going to let you spend an extra 20, 40, or 60 minutes a month with
Mhm.
the needy population, and you can bill for it and we'll pay you.
Mm.
That's wonderful, right? I'm a doctor. I think that's a great
Yeah.
service, but I don't have time. I can't document the process correctly.
Mhm.
I don't have the staff to do it. And so they just kind of have not participated. And
Mm.
what you get with chronic care management is patients get monthly check-in calls. They get at minimum 20 minutes of conversation. They get a care
Mhm.
plan developed for them. They get 24/7 access to a nurse, nutritional
Mm.
guidance, assistance scheduling appointments, care coordination.
Yeah.
And one last thing that is very important is combating loneliness. The ability to
Mm.
speak with someone other than your doctor every 3 months or when you're visiting, is very, very, very valuable service. So that's chronic care management. And
Yeah.
I believe every person that is eligible for that on Medicare should
Mhm.
be participating in a program like that,
Mhm.
especially because it is covered.
And correct me if I'm off on this, but my understanding is that like some of the reasons why those even the remote patient monitoring, the point is to increase the quality of living for the patients
Yeah.
and also it can drive down costs because maybe some of those with the remote patient monitoring, for example, maybe if they can catch something faster, it'll be a smaller problem that can be dealt with maybe inexpensively if we're talking about like the cost of medical care versus letting something go and they're not being monitored or something else happens and now something that could have been smaller can become something very severe or more costly since we're talking about cost to treat over the long haul. Am I off on that or is that kind of the I'm just trying
No,
to.
no, it's about early intervention. I mean, remote
Mhm.
patient monitoring is wonderful. Patients can get a device, and every single day, their vitals can be monitored, their weight
Yeah.
can be monitored. They don't have to be in front of a doctor. The
Mhm.
one that I love is a continuous glucose monitor for people
Mm.
with diabetes. I
Mhm.
mean, before it was, in order to know if your blood sugar spiked
Yeah.
or dropped was prick the finger, read the
Yeah.
results, get in touch with your doctor. Hopefully, it's not Sunday or Saturday when
Yes, yes.
other put a CGM on your arm, and
Mm.
that thing is constantly giving those readings And
Mm.
you could give it to the patient, you could give it to the caregiver, but you could also
Hmm.
give it to a team over here, that is a clinical resource that's watching and can at any time intervene and say, hey, I'm seeing
Hmm.
something wrong. What's going on? Oh, you
Hmm.
forgot to take your medicine. That's just
Yeah.
the number one thing. So yeah, remote patient monitoring is a really, really wonderful, valuable service.
And you mentioned also talking to somebody, like the human interaction, the human side of things. Like obviously, I'm a podcaster, so I'm a voice person, right? I got
Yeah.
these things in my ears all day long when I'm talking to people. So I value voice. What does that mean though for the Medicare patient, like the human voice? Like what does that mean to them?
Yeah, I think, to my 22-year-old, my 18-year-old, they probably don't care to speak. So they could do everything online and be okay.
Because they're in text too, text, right? There you go.
Yes, but we know for a fact that the Medicare population needs to talk to people.
Hmm.
We have proof of it that it matters. Even, I mean, some things can be done.
Of course, of course.
Book an appointment, get a script, but when you're discussing someone's health
Hmm.
or wanting to really understand how they're feeling, which is what we
Hmm.
do when we monthly check in, you have to talk to them. I mean, how many times
Yeah.
do we not send a text because we're not sure it's going to be interpreted properly?
Hmm.
And so same things apply here.
And to hear those signs, right? Like depression, sad, like happy, like you get, because just like any relationship, the more you can kind of tell what's going on sometimes, right? Like,
Yeah, you sound like you're having trouble breathing. Is everything okay?
mm,
Oh, I just
mm,
went up the steps. Do you normally feel? And you can get into deeper conversations. The other
yeah.
value is on the patient side. If they're alone and they're 85 years old and they don't have
Hmm.
someone to ask, and it is Sunday or it's 8 o'clock at night, the
Yeah.
ability to just speak with someone that is a professional, certified, to hear a soothing voice of a nurse. We actually dedicate nurses when they participate in chronic care management. We give them a dedicated nurse. If that nurse is
Hmm.
not available or working, they can talk to someone else. But sometimes it's just about hearing Nurse Bonnie tell you that's okay, that's
Yeah.
normal, or hearing Nurse Bonnie say you should probably get to the ER. That's
Mm,
also enough. Most of the times that's not the case,
hmm.
and we can identify what's happening. But when they hear the voice, it helps them as well. It's mutual for the doctor, nurse,
Hmm.
as well as the patient.
Yeah. Speaking specifically about Care Talk Health, is there a specific segment of the medical community, whether it's, size of clinic, hospital, or where, like, help me understand who in general are typically the best fit to work with Care Talk Health in the profession?
Yeah, so there's a right now who we're working with, and then there's a who we're in deep conversations with about to work
Yeah.
with. So who we're working with now are more, we're acquiring our patients through organizations that have, say members,
Hmm.
customers, or
Hmm. Hmm.
patients.
Yeah.
So we're working with right now device companies. I talked about the glucose monitor. We work with a pill dispensing company to do
Hmm.
medication adherence. We work with pharmacies to start to have some of these services in their
Yeah.
pharmacy. But the kind of I'll go to what's next is
Hmm.
working with the organizations that really play more into the mission that I talked about before,
Hmm.
which was those value-based care contracts, like the payers, the
Hmm.
ACOs, the healthcare systems that engage with us and make us a part of their strategic vision and their business
Hmm.
model going forward. So we
Yeah.
are in deep conversations right now with some key players, and that really ultimately is where the most impact will be made.
Hmm.
The other thing about our organization is we have a national NPI. So if needed, we can bill Medicare directly in all 50 states,
Hmm.
have physicians and nurses in all 50 states. So companies that are large and
Hmm.
need to scale quickly, we have the ability to do that if needed. That's a very unique
Yeah.
offering that we have that's different than some of our competitors.
Amazing. Krista, this has been a lot of fun having you on the show today. I know some people are watching, listen to this that may want to follow up and connect with your team and learn more. How do people connect with Care Talk Health?
Just go to caretalkhealth.com and there's a section where you can fill out a form for contact us and someone will get back to you right away. And if you want to connect with me, please do that. I accept all connections, and it's Krista Smolda on LinkedIn.
Amazing. And for everybody watching or listening to this, of course, we will put the website, so caretalkhealth.com, in the show notes so that you can just click on the link and head right on over. And speaking of the audience, if this is your first time with Mission Matters and you haven't done it yet, hit that subscribe or follow button. This is a daily show. Each and every day, we're bringing you new content, new stories, and hopefully new inspiration to help you along the way on your journey as well. So again, hit that subscribe or follow button. And Krista, so happy to have you on. Thank you again for making some time for us.
Thank you so much, Adam.